Thanks.
Hi, everyone. Thank you for joining us. We are Cole in the community. We are so excited to have Cole Academy here with us today with one of our very own BCBAs, Mr. Armando. He is one of our fabulous BCBAs out at our Cypress campus and has such a passion and knowledge for ABA and all things autism. And we're just so grateful and thankful to have him here with us today to give us this presentation. So without further ado, take it away, Armando.
Yes, thank you. Like you said, my name is Armando Bernal, and today we'll be going over keys for a successful transition for any child that's coming from the clinic going into a school system. So a little bit about me is that I was a special education teacher previously before becoming a BCBA. I worked in the life skills department for my elementary school and then moved into a resource classroom setting as well, working with children anywhere between the ages of 5 to 12, eventually joining into the ABA side of things. So I got to see a bit of both worlds, if you will. And so this first slide, I wanted to talk with everyone and discuss the differences between what you get at an ABA clinic as opposed to an elementary school. With ABA clinics, there will be a board certified behavior analyst as well as registered behavior technicians working with a child one-on-one and working through different skills or life acquisitions that they're hoping that the child would gain, as well as having a specific treatment plan. And what that means is that it lists any kind of resources that the child may need, as well as all the different goals that the child is hoping to gain within the next 6 months or so. There will also be a behavior support plan, and that's used primarily in order to identify the different behaviors that the child needs in order to be supported, and then the different strategies that a BCBA or the RBTs, as they're called, will use in order to make sure that these challenging or difficult behaviors could decrease over time as it's being used. There's also primarily more of a focus on social and daily living skills, as opposed to what's seen in an elementary school, which is more curriculum based, more math and reading on the elementary side, as opposed to pedestrian safety, fine motor skills, things like that on the ABA side. And then for ABA, there's also support through those significant behaviors, things that typically you wouldn't see in a classroom because they are so severe. So maybe aggression toward peers or aggression toward adults, things that can cause harm to either the child or others around them, that needs the more restrictive or more one-on-one approach found in the ABA. With an elementary school, primarily with this side is going to be one teacher and approximately 2 paraprofessionals, depending on the size of the classroom. And that classroom can range anywhere between 5 to maybe even 12 life skills kids, with each of them having an individualized educational plan, which is similar to a treatment plan, except it's focused more on the mathematic goals, reading goals, all those curriculum-based goals that we talked about a little earlier. They'll also have a behavior support plan, except it would be tweaked to determine what a child needs mostly within their individualized classroom or their life skills classroom. And finally, the things for elementary is that they'll support through educational and challenging behaviors. So if a child is having difficulty with a certain type of program found in math or reading, there will be support needed for that. Or if there is a challenging behavior, it won't be as severe as maybe those high intensity aggressions or the self-injurious behavior, but it would be for mouthing, like mouthing, they put things in their mouth, or they have certain, what we call stereotypies, so repetitive clapping or repetitive hand clapping, things like that. So my goal, I've always said this about it in my career, is that I'm trying to work myself out of a job. My whole goal is to make sure that the gap that is between what a typical child is able to do and what a child with autism may be able to do, or other disability, is to fill that gap and give them the skills they need in order to be successful. And typically within a school system, they're looking for certain aspects. And these are a few examples. The child should be potty trained before they can go into a school system. They need to remain seated for 20 to 30 minutes, and they have those self-advocacy skills. These 3 are listed at the top primarily because for potty training, you think of a teacher having 25 to 30 kids, and it's a lot more difficult to handle a child that may have had an accident on themselves or may need further support when there's other students that also need that teacher's help and their attention. As well as remaining seated is very important in order to make sure they're able to complete the task requested of them or be able to focus enough in order to provide them with the ability to grow in those curriculum fields. And finally, that self-advocacy skills are used in order for them to speak out for themselves. It's something that is a struggle at times within the ABA clinic where we have these kids, these wonderful kids, not being able to tell their RBT or their adult that they're thirsty or that they're hungry, that they would like to play with a certain toy. And because they don't have the self-advocacy, they struggle with determining what their next steps would be, whether they need to either communicate that appropriately or look at something more inappropriate, but has been able to give them certain results at the end of the day that we would need to work through together. So having that self-advocacy is so important because that is what's going to allow them to reach a certain level of independence as they get older. Or remaining seated for 20 to 30 minutes would give them enough time to go through a certain topic that would then move into them being able to focus on other aspects or maybe take a break after. Social skills is unbelievably important as it allows these kids to be able to work with other children their own age, be able to learn new skills from each other rather than just what is being told by another adult. It provides them those friendships that they'll need within not just elementary school, but every other program that they're a part of within middle school or high school. And also that community safety, making sure that they understand to look left or right when they're crossing the street in order to have their own welfare being taken care of. A lot of children, specifically in an ABA field, don't have those skills and need to be taught. And so we spend a lot of time on the ABA side of things, teaching these kids that they need to cross the street after looking both ways, or they need to be with an adult while they're crossing the street, things like that. That is taught to them so that way when they're in the school system, that teachers don't have to worry about that as much and can focus more on them learning the curriculum skills that they need in order to be successful in life. We also try and make sure that there's either a low or no instance of those problem behaviors. If there's certain levels of aggression, then that not only causes the disruption for the child individually, that causes them to not being able to learn the different skills being asked of them, but it also causes possibly other problems with other children. It causes distractions that causes the others around them to not being able to learn as much or be able to focus as much. And so us being able to be so heavily involved now will provide them with further independence and growth within the future. And finally, we can do everything we want within the ABA clinic, but we also need to have the parents understand the basics of what we do here, that applied behavior analysis. What do you do when you're at home and the BCBA, myself, are not around and your child is throwing a tantrum? What are those certain skills that are needed in order to take care of them? And so, like I said earlier, is that I am trying to work myself out of a job by providing these kids not only with the support and growth they need to succeed, but also those parents, because together they'll be together for the rest of their lives and can further allow the promotion of success and independence to grow. Whenever you're thinking of these different goals, right, that you want to grow, you think of things that are small that can then turn into bigger achievements and bigger successes for these kids. So take a minute and think about it on your own on what goals that would be very specific to your child, and what you're hoping for them to accomplish. And then once you figure out those goals, think about what are the steps I need to take in order to see my child succeed. See what small goals need to be done before they can reach this bigger, larger goal that is being shown to them. So we talked about the last slide, potty training, how potty training is important because these teachers are not able to manage every child that needs to go to the bathroom individually, rather they just go as a whole. So we want a child to be potty trained. Then we think of what is the earliest amount of time that the child can go before they are wet or they have an accident. maybe it's 5 minutes, maybe it's 15, maybe more, maybe less, but you take that very beginning step of how long can my child go without being without having an accident, excuse me, and then take that goal and then raise it even further each and every time. So if it starts at 5 minutes that they're dry, then maybe go to 10 minutes or maybe go to 15 and keep that up until the child is at a certain level that you want them to be at in order to be potty trained or be able to spontaneously ask you one day when you're in the grocery store, hey, I need to go to the bathroom, and be able to take them and they actually successfully be able to go. So thinking of these smaller goals is very important in order to ensure that your child or any child is able to be successful in the future. So with that being said, when we're moving from an ABA clinic into the school system, we want to focus more on what service plan or what plan of action is being used in order for this child to be successful within the school system, because it is very different, but oddly also very similar to what an ABA clinic is run as within the school system. So we try and specify the goals and information that is needed for the school to understand the child being transitioned. What are the specific toys or food items that this child likes that they could possibly work for in order to accomplish goals? Or what are the different mannerisms? What are the different problems that could be foreseen? And how are these problems often resolved? And that comes when you look at the child's behavior support plan that was shared by the BCBA or shared by the teacher, or being able to take this behavior support plan or being able to take these different goals and these expectations and reviewing the type of interventions or the type of solutions that can be used in order to resolve these problems in a different setting that could be brand new to that child. This service plan will also describe the times and the typical appointments being used in order to see a speech therapist, an occupational therapist, physical therapist, and making sure that everyone is on board and understanding that at certain times of the day or at certain times of the week, that this child needs these certain skills, these ancillary skills, in order to be successful even further than what they already are. So it's all about collaboration and making sure that everyone is responsible to complete this child's aspects in learning. And what's really important is making sure as a parent that there is a timeline for that transition being set. It's very important to not be surprised one day that the child's gonna be moved into a school system. That will often never happen, because that communication should be set up where you ask your BCBA or you ask your teachers and say, hey, when is my child expected to move into the school system? And it should be a rough estimate from resources I'll give you in a little bit from the presentation, about 9 to 12 months ahead of time. As well as making sure that a behavior support plan is put into place to help these teachers in the school system know the same kind of criteria used in the ABA clinic would then be used also within that teacher's classroom. And it's not a mandatory thing, but it's always allowed that and voluntary that a teacher or other school personnel come and observe the child within the ABA clinic beforehand in order to see the type of learning or the type of way that this child is being taught, in order to make sure that every skill shown in the ABA clinic or demonstrated could then be transferred into the school system. It's more collaboration than anything else, and making sure that everyone is on the same page, because at the end of the day, we're all here to help and support these kids. And the best way to do that is to talk to each other. So we talked about a typical service plan, and now this is going to be a transition checklist for the parent. So making sure that you're informed on what the transition looks like or what a tentative transition date would be. And then talking with the BCBA about, can we move it up a little bit? Can we move it back a little bit? And that conversation should be very open. Just be open and honest about what you want or how you feel. And I'm sure that BCBA will help you. Encouraging the parent participation. We at Cole have tried to do our best to mimic some events that occur in the school system in here, so it's very familiar to the parents when they go to the school system, that they'll do toy drives, or they'll do field days. So it's something that is familiar to the students as well. But being able to be a part of school experience is absolutely amazing, and certainly something that everyone should be a part of. What's more also is that the BCBA will discuss with a parent about being able to meet school specialists, because there's a possibility that the school district may not have a board certified behavior analyst as their behavior specialist. It could be a very well experienced special education teacher or other professional that knows about behavior. So it's important to meet them as well, or having a licensed school psychologist and meeting them and understanding what criteria is being used in order to better support your child. So making sure that all of this plays into effect. Ensuring that any skills are being generalized at the home as well as other settings. I try to tell my parents, at least, that every time that we teach something in a clinic, that's very good. I'm very excited for the child. Except we need to make sure that what's being taught here is then being better supported and better taught within the home setting, or it's being mastered also in other settings. Because they, with any luck, will not spend a lot of time in the ABA clinics, but would rather have this time to support them further for the rest of their lives. That we want them to be able to look both ways when crossing the street, not just when they're with a therapist, but when they're with their mother or father, or when they're with their teacher or anyone else in the rest of their lives. And with that being said, we have a bridge program here at Cole that better supports this. It allows these children to understand what a typical classroom may look like, what kind of school supplies they may be taking a part of, as well as allowing parents to observe it and see what kind of things these children are learning. To see that there is a lead teacher that allows the children to work with and communicate with, while also still having that one-on-one support by having their therapist be on the sidelines and providing them with their independence and growth that they need, that they'll typically see within a classroom. And making sure that parent trainings then transition from this is an ABA clinic, this is what we do, to this is what a typical school may expect, or this is what a typical school may be discussing with you once you arrive at this certain time. So parent training should eventually transition into that ability to prepare you for not just what school would look like, but possibly also what IEP meetings look like, what a meeting with the student's teacher may look like, things of that nature, to make sure that there are no surprises once moving into the school system. Any assessment documentation or any kind of insurance reports could be sent to the school as well. That would be something that is talked to the BCBA about in order to ensure that everyone is on board and everything's up to date. Because if the very initial assessment is brought up, that's not going to tell the whole story of how this child is doing. We need the most up-to-date version in order to see the most success from the child. And then finally, for this parent transition checklist, summarizing any and all important information regarding the child to the teacher, making sure they know this child backwards and forwards, because that is going to provide that teacher with no surprises as well, but also the smoothest transition for that child. Because it can be scary. It can be scary going from one setting that was very familiar to someone for quite some time to a brand new setting with new peers or new teachers or new friends that they're not super familiar with. So making sure that there is that sense of familiarity is very important. And so when we think about the parent transition checklist, we want to make sure that we think about a checklist for the child, making sure that daily living and classroom skills are then targeted rather than the social aspect, making sure that they understand exactly the type of skills being found in a classroom, or what we call approximating the learning environment, making a classroom very similar to what a classroom in the school system may look like. And that's what we have at Bridge, being able to perform or demonstrate what a classroom could look like potentially once going into a school system. Allowing these children to use supplies and materials that are commonly found in the classroom as well, to be familiar with scissors, how to use them, be familiar with not just glue sticks, but maybe the regular squeezy glue or colored pencils. What does art look like? What does computer time look like? All of these things that could potentially be found in a classroom should be very familiar to these kids as they're transitioning. And one thing, this is part of the children checklist, but it could also be great for parents or for the BCBA to provide as well, is social stories, visual supports, and other resources that could further prepare the child, providing the child with their name in a story or their picture or a picture of their future school, their future teacher. A lot of teachers, more often than not, will act, if you ask them for a picture of themselves or a picture of their future classroom, they'll be more than happy to oblige, more than happy to give you anything that you need in order to see the most success, because these teachers care about these children before they even get there. And from my experience, that was always the case, just making sure that the children were the most prepared as possible. And then finally, providing any materials that could transition with the child. Maybe they need a visual schedule or the picture exchange board, or being able to train these teachers on the different interventions that these children are using that are seeing success. Unfortunately, there's ABA is still so new in the field that some teachers may not be super familiar with the different interventions or different strategies that are used in order to provide these students or these kids with the most success. And so that allows the BCBA or the parent, especially the parent, to tell the teachers, hey, this is what we're currently using, or this is what my BCBA is currently using in the clinic. And it's a great time or strategy in order to test yourself, in order to see how much do I really know of what's going on with my kid in the ABA clinic. And if you still have questions, myself or any other BCBA that you work with is more than happy to help you, more than happy to be there for you, because we just want to see what's best for your child. And like I just said, we are always available. We will always be happy to meet you and talk with you about how things are going with your child, or setting up a pre-meeting with the school system to discuss transition and placement. Because that placement could vary. It could be into a life skills program or an autism-centric program, resource classroom, things of that nature. It really just depends on the child and where the school system best sees where they are. But making sure that things that are very important are covered. So making sure, most importantly, that you're happy with where they're wanting to see your child, or asking questions of, what does a life skills program entail? Can I observe a life skills classroom so I can see where you want to put my child? Never being afraid to ask the questions that are needed in order to see your child become the most successful that they possibly can be. Making sure that safety precautions are put into these problem behaviors that may be seen by your child. It is always very scary to see the news sometimes with what occurs with children, because people were not aware or not informed by what safety precautions should be taken. And so acknowledging these safety rules or these regulations can be very important to make sure that everyone understands, okay, in this situation, I need to do this, or I need to ask for help in this situation. Making sure that communication is key. I firmly believe, and I try and tell all of my parents that I'm very open to conversation. I'm very open to communication. So ensuring that the safety of the kid is of the utmost importance, and making sure that all services are available to the school, at the school that you're going to, or just asking what those services entail, what does it cover, and if there's anything else that could be added, or is what is given enough for the child. Any licensed school psychologist, any behavior specialist will be more than happy to discuss this with you, or getting the opinion of the BCBA to determine what would be really beneficial to the child. And making sure that an IEP meeting is added in or scheduled in order to make sure that everyone is on board, everyone understands the type of need that the child has. For IEP meetings, we're always able to join those. As a BCBA, if you ever ask us to take part in that, we're more than happy to do that. We're more than happy to be there for you. And we can act as a sense of support for you. If there are questions that you may have, we can either help answer or provide an opinion to the school system on what is currently occurring. They may ask for an educational evaluation of your child. That's not to negate what was said in the medical evaluation, but it just provides the school system with further support on how they can help your child. And one very important question is asking, will ABA still be involved? Not every child that goes to the school system would have full-time school. Maybe they have part-time ABA and part-time school. That's okay. But asking these questions helps clear up any confusion that may occur in order to ensure that everyone is able to help the child. And so with IEP meetings, as I said, we're always invited. We can always help out. And these IEPs are able to help children engage in these goals to match state standards. ABA programs focus on the medical necessity, while those IEPs or these individual education plans will help the child reach certain goals they need in order to accomplish things in math, accomplish things in science or social studies. Excuse me. And with making sure that the teachers understand behavioral programming and never being afraid to ask if there's extended school year services. These services happen during the summer, and they're able to provide continual support for the child when the school year ends. So that way there's no sense of aggression, or there's no sense of decrease in the skills that have been learned throughout the year. As I said earlier, trying to make sure that the physical environment being matched in an ABA clinic or a school matches the needs of the child. If you have a child that is visually impaired, making sure that there are resources for that child in the classroom, or maybe they have autism or a learning disability, what resources are needed in order to see them be the most successful? And being able to discuss these present levels of performance. Where is your child at currently? Where does your teacher want them to go, or can they go? And then moving, like I said earlier, from a small goal to a larger goal to a larger, until you reach that final goal that you're wanting them to reach. And so transition starts now. There is no age limit on the goals of transition, and making sure that the VB map is following what is exactly needed in order for these goals to be created. What's very important is to make sure that the child is an active self-advocate in their IEP meeting, making sure that everything that is being assisted by the child is being centered on what their plans are. As they get older, maybe the child is maybe 3 or 6 right now, but eventually they'll be 16 or 26. One day they're going to be an adult. And it's important for them to have a voice in their programs and what they're wanting to be supported in, finding out what they like the most, and then using that to further promote the goals that they're wanting to achieve in their own lives. And above all, throughout this whole training, I just want to stress for you to know your rights, understanding what is allowed, what is not allowed, what you can ask, what can't be asked, things of that nature. And so in this slide, we have 2 resources, and then there's some coming up, where rights law is a resource regarding special education law and advocacy. So please look this up if you have any questions regarding these resources. And also below is the transition checklist that's spoken up earlier in the PowerPoint, but making sure it's just written down for you in case you were needing to write anything down or anything really caught your eye. All of it is centered on this transition checklist. And the Texas Project First is a resource that allows you to understand the SPED process, the different age ranges broken up into as well. And the website primarily is very easy to use, and definitely a wonderful resource that could be spoken of. And finally, we have 3 other resources to speak of. We have our legal framework, where it provides any state, local, or federal laws. Also has videos. And then we have the parent guide for the IEP process. I know I mentioned it briefly, but this breaks it down further on what is being put into an IEP, as well as what could be further discussed within your IEP meeting. And finally, this is a wonderful resource that I've heard quite a bit about, was the SPED text. So if there's ever a quick question that you have about what is going on currently in an IEP meeting, what they're asking, what a school system asking you to do, things of that nature, calling this number here, the 1-855 SPED text, will allow you to speak to a real person, to a person very knowledgeable in SPED law and SPED resources, that can provide you with those further answers to questions you may have, or has a great list of resources for online training as well. And with that being said, I want to say thank you to everyone listening. I hope this was helpful and beneficial. If you ever have any questions, I'm more than happy to answer, as well as anyone else at Cole Health. And we thank you for your time.
Thank you so much, Armando. Beautiful presentation and
Thank you.
so much great knowledge. We'll go ahead and stop the recording so we can take question and answers at this time. So thank you.
Thank you.